Even the most well-designed instrument processing system will fail if people aren't working collaboratively. There's no amount of equipment, supplies, or planning that can overcome the behaviors of those responsible for instrument quality. Teamwork matters. Many different people, as you know, are part of the surgical instrument management process. From the sterile processing technicians who clean and sterilize the instruments to the nurses and doctors who use them during surgeries and treatments. If these individuals aren't working collaboratively, if they aren't working together, if they're not communicating effectively, mistakes can happen. Instruments might not be properly cleaned, or they might not be available when needed in surgery. There has to be responsibility and accountability in the instrument system. Each person involved in instrument processing has a crucial role to play. Everyone involved with surgical instruments must understand the importance of their job and take responsibility for that job. If someone doesn't take their role seriously or doesn't follow established procedures or protocol, it can lead to compromised patient safety. Training and education. Proper training is essential for everyone involved in the instrument processing system. This includes a thorough understanding of cleaning, sterilization, and how to handle instruments correctly. Ongoing education is also important because medical practices and guidelines can change, and everyone needs to stay up to date. Good communication is the foundation of teamwork. Good communication is the foundation of collaborative work. People need to be able to share information, ask questions. People need to be able to report any issues or concerns regarding instrumentation promptly. This will, of course, ensure that problems can be addressed and corrected before they lead to serious consequences. Quality control. Regular quality control checks and audits should be conducted to verify that the system is working correctly. Nothing is left to chance. It is critical that all individuals are following established procedures and protocols consistently. If issues are discovered, they can be addressed and used as opportunities for improvement. So while equipment, supplies, and planning are crucial components of a well-functioning instrument processing system in a hospital, the behavior and collaboration of the people responsible for instrument quality are equally, if not more, important. The instrument system requires a dedicated and coordinated team effort to ensure the safety and well-being of patients. Patient safety depends on the people charged with performing each instrument-related task. Having the proper tools and equipment to complete these tasks is critical. Having the proper physical work environment to perform these tasks is absolutely important. Adequate information for each step in the process provides a great starting point for a well-run instrument system. Remember, the human component is the most important component in the instrument system. Welcome to Chapter 2, Human Factors in Instrument Processing. Let's take a look at our learning objectives. We will define human factors and the impact they can have on successful process outcomes. We will describe the impact that human relationships can have on quality, productivity, and the work environment. We will discuss strategies for dealing with challenges on the job in a positive way. We will define bullying and discuss strategies to address this negative behavior. And finally, we will discuss factors that impact work groups. The use of high quality instruments is of paramount importance. Surgeons rely on precision and reliability in their tools to ensure the safety and success of medical procedures. This extends not only to individual instruments, but also the entire instrument system. So this includes the organization and arrangement of instruments in surgical trays and sets. The quality of surgical instruments starts with their manufacturing, the manufacturing process. For example, surgical scissors must be precisely machined to ensure that their cutting edges align perfectly. Remember, surgical instruments are precision tools. Even a minor deviation in the manufacturing process can affect the performance during surgery. Instrument materials. The choice of materials is critical. For instance, using high-grade stainless steel ensures that instruments are corrosion resistant, durable, and biocompatible. This helps prevent contamination and allergic reactions in patients. Regular maintenance and calibration of surgical instruments are essential. For example, back to that scissor. Ensuring that surgical scissors are always sharp guarantees clean cuts, which reduces trauma and other complications during surgery. Instrument organization. Surgical trays and sets must be meticulously organized to enable quick and accurate access to the required instruments during procedures. Each instrument's placement matters. We want to prevent confusion and save time, not the opposite. Instrument sterilization. Proper sterilization protocols are vital. Instruments must be sterilized effectively to prevent infections. Any compromise in this step can have serious consequences for patients. Instrument tracking. Many hospitals use tracking systems to monitor the usage and sterilization history of surgical instruments. Tracking ensures that only properly maintained and sterilized instruments are used in procedures. Instrument training. Surgeons and surgical teams must be trained to use instruments correctly. When instruments are used appropriately, we extend the life of that instrument. Instrument training is very important when it comes to the instrument system. So an example would be laparoscopic instruments. They require specific skills and techniques for minimally invasive procedures. These things are to be used in a very specific way to prevent them from becoming damaged. Instrument innovation. Advances in technology lead to the development of more accurate and efficient surgical instruments. The instrument system is critical in ensuring quality and accuracy in the entire ecosystem of surgical instruments, from manufacturing to organization and usage. The smallest details, materials, and maintenance procedures can impact patient outcomes and the success of surgical procedures. Healthcare institutions and professionals must prioritize excellence in instrument systems to ensure safe and effective surgeries. Quality and accuracy in surgical instrument sets and trays depend upon quality and accuracy within the instrument system. In a healthcare setting, the instrument system refers to the entire infrastructure surrounding surgical instruments. Documentation, information management, maintenance, and the technology used to support surgical procedures. When information is missing or incorrect in the instrument system, when systems are outdated, that can have serious implications for the quality of care and patient safety. Humans rely on systems. When information is missing or incorrect, quality is diminished. Whenever quality is diminished, patient risk increases. When systems are outdated, the risk of errors increases. Information, of course, is critical. People need information to do their jobs well. Information errors fall into three categories: incorrect information, inadequate or not enough information, and non compliance. Let's talk about incorrect information. Errors increase when the information provided is incorrect. These kinds of errors can result from outdated procedures, outdated instructions for use, incorrect training practices, incorrect information provided by a coworker. Anytime we have errors, the quality of our work goes down. Whenever the quality goes down because of errors, patient risk increases. Errors lead to increased threats to patient safety. The system has to have correct information. Errors can be very costly. Errors can also lead to customer frustration. And errors will definitely, if they go unchecked, lead to a lack of trust. Then there's inadequate information. So when there's a lack of information, we also have increases in errors, increased risk to our patients. We don't want people guessing. And that is exactly what happens when the information provided by the instrument system is not adequate. When information is inadequate, employees may have to guess about the process. And of course, there should be no guessing in our line of work. Information in the instrument system must be current, accurate, and above all else, it must be accessible and user friendly. Non compliance occurs when the correct information is provided, but staff chooses not to follow the information. So, change is a constant in our line of work. An over reliance on our memories can lead to costly mistakes. People thinking that they don't have to use count sheets or recipe cards to set up trays, this can lead to serious problems. We don't want anyone relying on their memory when it comes to this kind of activity. So there are going to be changes, but all changes must be communicated as they occur to everyone. All technicians are required to verify tray contents with the most current tray listing and instructions for use. This is not optional, this is the way it is. Non-compliance can also indicate poor attitude. It could indicate a lack of understanding of the importance of following instructions. Having a that's good enough attitude is not going to cut it in our world. We need to have full understanding of what we're doing, and we need to follow instructions consistently. It doesn't matter, should never be in our vocabulary. So, having a that's good enough attitude will ultimately lead to skipped processing steps. Let's talk a little bit about the danger of complacency. Complacency is going to lead to errors. Even pilots that have been flying for 20 years use checklists every single time. Lives depend on the work that we do. We cannot become complacent. Always remember the importance of each task. always keep in mind, always remember, you are affecting patient outcomes. The bottom line is you've been trained, you're a professional, work like one. Let's talk about some stress factors that lead to errors, stress factors that lead to mistakes. So, of course, errors can occur in various work settings, including healthcare, manufacturing, or any environment where tasks require precision and attention to detail. These errors, in many cases, result from factors like time pressure, unrealistic expectations, stress, and yes, interruptions. To mitigate these errors, we need to establish realistic expectations. We need to manage stress, minimize unnecessary interruptions in the workplace, and create a conducive work environment. Errors occur for a variety of reasons. Errors can occur due to inadequate training and a lack of confidence in certain processes. If your training hasn't been sufficient, if your training hasn't been adequate, you're not going to feel very confident about what you're doing. So, lack of confidence and inadequate training increases the likelihood of mistakes and can also make the job more challenging. So, well designed systems and a culture that promotes communication and knowledge sharing play essential roles in reducing errors and enhancing overall competency. So let's talk a little bit more about inadequate training and uncertainty. Inadequate training and feeling unsure about a process significantly increases the chance of errors. Uncertainty not only raises the risk of mistakes, but also makes the job more difficult. It adds complexity to the job. Effective system design. Well designed systems are crucial for reducing errors. So, an instrument system that provides clear guidance, step by step procedures, and the necessary resources can help employees perform their tasks more accurately and confidently. Technician training and competency. So, to mitigate errors, it is imperative that each technician receives thorough training and that their competency is regularly verified. Competent technicians are more likely to perform tasks accurately and confidently. Promoting a culture of communication. The department's culture should foster an environment where employees feel comfortable asking questions and sharing information. Open communication allows for the exchange of knowledge and experiences, reducing the likelihood of errors due to uncertainty. The overarching goal should be to enhance everybody's knowledge and everyone's skills. Continuous learning and development not only reduces errors, it also contributes to the overall improvement of the team's competency. So, reducing errors in the instrument system and enhancing job performance involves addressing issues related to the following: training, confidence, system design, organizational culture. We reduce errors by investing in training, verifying competency, and by promoting open communication. Remember, the goal is to improve the knowledge and skills of every team member and ultimately create a more error resistant and efficient workplace. Everyone within the instrument system contributes to patient outcomes. It's important to recognize and understand that everybody wants to perform well. Nobody comes to work thinking, I am going to mess things up today. For the most part, it's been my experience. People want to do a good job. The fact is, individual performance can vary from day to day. These fluctuations in performance can directly affect patient safety. Collective impact and outcomes. In the instrument processing system, every individual from technicians to supervisors plays a role in determining the final outcomes. The collective effort of the team directly influences the quality and safety of patient care. Reprocessing surgical instruments is a team sport. Desire for excellence. It's important to acknowledge that the majority of people genuinely want to excel in their job. They want to do well. Technicians strive for accuracy and safety in instrument processing because they understand its impact on patient well-being. It's about outcomes. It's about what you do impacting whether the patient does well or not. Performance variability. So, like we mentioned, people, like everyone else, have good days and challenging days. And it is normal for people to perform at different levels, but as leaders, we also need to keep that in mind. This variability can influence the consistency and quality of instrument processing. So, what are the patient safety implications here? Fluctuations in individual performance can have significant consequences for patient safety. Even minor errors in instrument processing can lead to complications during medical procedures. It is crucial to implement measures that account for these variations and maintain consistent quality standards. Human errors also result from issues outside of the workplace. For example, staying up all night with a sick child may cause a situation where a technician is tired, possibly absent-minded, short-tempered. These factors that are out of the healthcare facility's control can absolutely impact outcomes. Here's some other examples. Personal problems, substance abuse, mental health issues. All of these are factors that can impact outcomes that the facility has no control over. Emotional health issues, complacency or boredom, stress, physical pain or illness. These underlying issues can impact the work area and individual performance. When that happens, of course, work quality can suffer. If a situation is impacting work performance, it is critically important for that employee to seek the appropriate help from qualified resources. It is your professional obligation to get things right with yourself in order to do your job correctly. Let's talk about some ingredients for a safe instrument tray. Number one, the technician's emotional state. Inspecting instruments and preparing them for use requires concentration and attention to detail. Anytime someone is preoccupied, the risk of error increases. Environmental conditions. Technicians must be able to work in an environment with the right environmental conditions. The work area should be well lit and ergonomically appropriate. Distractions should be kept to a minimum, and the work area should be arranged in a manner that facilitates the tasks required. You have to be physically well to do this job. Providing support for surgical procedures is a very demanding job. No discussion of the human side of instrument processing would be complete without the mention of physical well-being. Capabilities and limitations. Instrument handling requires special skills and knowledge. So training and continuing education is absolutely critical. Detailed training plans and competencies can help to ensure that each instrument technician has the skills and knowledge needed to perform specific job tasks. For example, somebody could have bad eyes. A technician may have some difficulty seeing detail when inspecting surgical instruments. Maybe they need an eye exam. Maybe they need some glasses. The human factor. Human factors that influence instrument quality. So we have the technician's emotional state, physical issues, environmental conditions, and capabilities and limitations. If we want to produce consistent quality instrument trays, it's critically important that we pay attention to these factors. In the healthcare setting, the central mission is to serve patients and ensure that their care and treatment needs are met. This mission guides all of the actions within the organization. Each department plays its own unique role in ensuring that the mission is carried out, serving patients and ensuring that their needs are met. So the entire team, every department and employees contributes to the comprehensive and holistic care of patients, like pieces of a puzzle fitting neatly together. We've completed learning objective number 1. We've defined human factors and the impact they can have on successful process outcomes. Let's talk about challenges. So we're going to have some communication issues. There will be some prioritization issues, territorial issues, poor attitudes, and sometimes just plain bad behavior. We have to deal on the job with all kinds of challenges. These challenges can cause problems and impact patient outcomes. Regardless of the challenges, we are all on the patient's side. It's not about you. So once everybody is clear on this common goal, the patient, everyone can focus on actions that are in the best interest of the patient. In situations where stress levels and expectations are high, any delays or deficiencies in instrument sets can be frustrating. This frustration may lead to impulsive words spoken in the heat of the moment. What comes after those words are spoken can be very challenging to mend. So it's important that we understand the dynamic nature of our environment. It's important to recognize that stress and high expectations can lead to frustration. It's built in. This in turn can result in those impulsive words being spoken. So, to maintain a positive and productive work environment, which is what we all want, we need to encourage open communication and conflict resolution to prevent potential damage to relationships and teamwork. So, clear rules of conduct, professional behaviors are essential for a productive relationship between the operating room and CS teams. When people know that these rules are in place, they can help to eliminate many negative situations and ensure a much better working environment. Establishing rules of conduct and professional behavior. So our rules need to be clearly defined. The establishment of clear and well-defined rules of conduct and professional behavior can effectively prevent and mitigate negative situations. Rules of conduct creates a framework for professionalism, respect, which fosters a positive and productive work environment. Anytime a frustrated customer approaches you, physician, nurse, technician, the very first thing on your mind should be de-escalating the situation. We don't do the rah-rah stuff. That's not who we are. We appreciate the big picture. We know what's important. De-escalate first. Take steps to bring the focus back to the patient. Take care of the immediate need now. Of course, the patient's well-being is the highest priority. Any item required for a case in progress must be urgently prioritized. Never delay the specific immediate needs of the patient. In the event that an immediate patient need was not met, we have a problem. It is essential to report this information to the supervisor right away. When this happens, both departments need to take a deep dive into what just occurred and why. So a root cause analysis is going to be completed to identify the specific factors leading to whatever the issue is. We're going to get to some preventative measures to avoid this problem from happening again in the future. These measures must be put into place as soon as possible. We do not have the luxury of time. Patient priority. Again, the patient needs always comes first. This is not about you, especially when an item is required for a case in progress.
Prioritize the patient's well-being above all else.
No delay in patient care. Patient-specific needs should never be delayed. So timely access to necessary items is essential. We want to always make sure that each and every patient receives the best care possible. That's job one. Incident reporting. In the event there's an issue that occurs, it is crucial that it is reported promptly to the department supervisor. Effective communication about incidents is vital for addressing and resolving problems. So both departments should collaborate on a root cause analysis. This analysis is going to help to identify the underlying factors and any missteps that may have contributed to the problem at hand. So a collaborative approach, teamwork, will enable the development of strategies to prevent similar incidents from happening again in the future. Mistakes are not intentional, they happen. Acknowledging errors is essential because it provides us with an opportunity to learn and to improve. Errors are an opportunity to get better. Errors happen, and when they do, when we discuss errors, we want to maintain our professionalism.
The primary focus should always be on prioritizing the patient's needs.
Unintentional mistakes. Like we said earlier, nobody intends to make mistakes in healthcare, but they happen. They can occur due to a variety of factors. Learning from errors. Again, acknowledging errors is the first step in the learning process. We learn from them, we get better. Acknowledging errors opens the door to improvement. Acknowledging errors helps prevent similar mistakes from happening in the future. Professional discussions. Whenever we're discussing errors, it's important to maintain a professional and respectful tone to our partners in the operating room or whatever department we're dealing with. Your professionalism, your courtesy will go a long way. Constructive conversations facilitate problem solving and growth. Patient-centered care. Above all, over everything, patients' needs must take precedence. It is your number one priority.
Ensuring the patient receives the best care remains the ultimate goal, even when addressing errors.
Set a time for direct follow-up with the customer. So letting the customer know exactly when you intend to follow up is going to be very beneficial for you and your relationship with that customer. If time and the situation permits, of course, you could follow up immediately. You can wait around till the end of the shift to follow up with the OR about the issue. Remember, you want to keep it professional. We want to focus on what can be done to prevent a similar incident from happening again. Employees should have the chance to address one another regarding whatever the situation may be in a professional way. It's really good for teamwork and collaboration. Don't allow your exchanges to become personal. Be professional at all times. It's not about you. It's about the patient. It's about the situation. We need to recognize that when situations don't go as planned, people are going to be frustrated, but we shouldn't internalize this frustration. Allow it to play out. Remain professional. Focus on the situation that needs a solution. Do not allow your exchanges with the customer to become personal. So, after an incident, it is absolutely essential for follow up communication. The operating room and sterile processing must work together to improve the system. This is your opportunity to educate others about parts of the system that may not be clearly understood to them. Take advantage of this time. You want to make sure that as a professional, you gain a fuller understanding. You want to really appreciate the customer's point of view. So, effective follow up communication when you're dealing with the customer is key. Effective follow up communication in customer service is crucial. You want to keep in mind that it involves working together collaboratively to improve the system. How do we make this better for the patient? Take the opportunity to educate others about less understood parts of the system. Maybe the operating room doesn't know how long it takes to turn over a particular set of trays. Keep it professional, but take full advantage of the opportunity if it's necessary to educate them on the process. Take the opportunity to understand the customer's point of view. This will enhance your overall understanding and help you to become a better professional. Essential follow up. It is a key part of dealing with the customer and attempting to resolve the situation.
It enhances the system and improves overall service quality.
Working together is key to system improvement. Collaboration, teamwork. These efforts can identify areas where the system can be enhanced to better meet the customer's needs. Educating others about less understood aspects of the system is valuable. Take advantage of the opportunity. Improved understanding across the teams can lead to more efficient and effective customer service. Understanding customer perspective. Take advantage of the opportunity to learn as much as you can about the customer's perspective. This information is going to be critical not only for resolving the current situation, but for looking at other issues in the future. This understanding that you'll gain helps in delivering more personalized and effective service. Relationships can be improved by placing focused attention on meeting the patient's needs and increasing system efficiencies. Don't allow your exchanges to become personal. It's not about you. It's about providing solutions to very important problems. Develop action plans. So, whenever we're faced with challenges or issues, the first step is to develop clear action plans. You need a roadmap. You got to get from here to there. These action plans are going to outline the steps and strategies needed to address the specific problem, implement changes and improvements. So once your action plans are in place, it's crucial to execute the necessary changes and improvements. You got to follow through. Plans on paper mean nothing. What we need is action. This proactive approach helps to prevent the repetition of similar issues in the future. We've discussed strategies for dealing with challenges positively. We live and work in the real world, and from time to time, we are going to come across people behaving badly. You are going to encounter people exhibiting behaviors that are considered unacceptable. While harassment and discrimination are typically covered in employment policies, there may be other problematic behaviors that are not explicitly defined. In such cases, addressing these issues is crucial for maintaining a healthy work environment. Let's talk a little bit about prioritization in the workplace and work styles. A common cause of frustration within the work group is prioritization decisions and work styles. Not everyone is on the same page. In order for the instrument system to be efficient, technicians must make instrument processing prioritization decisions many times per shift. If you're not a thinking technician, you're not a technician. Of course, items needed immediately must be processed immediately. Remember, take care of the most immediate need now. Central services and the operating room should work together to establish prioritization guidelines and educate staff about those guidelines. It is critically important that people understand what the expectations are. Establishing prioritization guidelines will help in that effort. Technicians become frustrated if fellow staff members are able to pick and choose what trays they want to work on. That is no way to run a central service department. This can all be avoided by putting in place instrument prioritization guidelines for all sets in the assembly area. Expectations are key. People need to know what you want them to do. So these bad behaviors. Let's talk about handling unacceptable behavior. We will undoubtedly encounter behaviors from coworkers or supervisors that are deemed unacceptable in the workplace. When we are faced with these kinds of situations, addressing them becomes essential. Addressing them becomes essential to maintaining a positive work environment. This kind of thing can't be swept under the rug or ignored. Options for resolution. So these kinds of behaviors are going to vary. Resolving them may require different kinds of approaches. In some cases, it may be possible to resolve the situation privately with the individual one-on-one, and in other cases, it may be necessary to involve a manager or a supervisor to mediate the situation and take appropriate action. So, harassment and discrimination actions are typically addressed explicitly in employment policies and procedures and should be reported and handled in accordance with these policies. As we've discussed, there can be other behaviors that are not as clearly defined as harassment and discrimination. These issues also need to be resolved. They can still be problematic. They need to be resolved. Any behaviors that have a negative impact on staff should be addressed immediately. One such issue faced by many central service departments is bullying. Obviously, bullying can severely and adversely affect the instrument system. To counteract this negative behavior, it is essential to deal with it head on. It is essential to establish protocols for acceptable behavior. Without clear behavior standards, an unhealthy work environment with negative energy may prevail. Obviously, this is going to consume valuable energy that could be better utilized, say, setting up trays, organizing the storeroom. These behaviors must be dealt with promptly. Negative impact of behaviors. These kinds of behaviors should not be tolerated in the workplace. There's no room for them. Behaviors that negatively affect the staff should not be tolerated in the workplace. If you are in such a place and you've tried to get these issues resolved and they are still unresolved, you need to get out. Addressing these issues is crucial for maintaining a healthy and productive environment. Bullying in central service departments. Bullying is a concern in many CS departments. This negative behavior can disrupt the instrument system, which will ultimately lead to errors. It is essential to address and mitigate bullying behaviors, establishing acceptable behavior protocols. So, to counter negative behaviors, it is necessary to establish clear protocols for acceptable behavior in the workplace. People need to be educated on these established behavior protocols. These protocols will set the standard for respectful and professional conduct. Unhealthy environment without standards. In the absence of standards, an unhealthy work environment can develop. This unhealthy work environment is characterized by negative energy and constant tension. This can have a detrimental effect on staff well-being and productivity. Energy consumption. Negative behaviors consume valuable energy that could be better directed towards more productive activities in the department. Addressing and preventing these behaviors helps preserve positive energy within the organization. Bullying can take place between coworkers, between managers and their employees, or between an employee and their manager. Bullying can take many different forms. Bullying is often characterized as the following: abusive and offensive language, insults, teasing, spreading rumors and innuendo, unreasonable criticism, trivializing someone's work or their achievements can be considered bullying.
In any form, bullying has a negative impact on individuals and on the work group. Individuals who are being bullied may experience
reduced self-esteem, musculoskeletal problems, sleep and digestive disturbances, increased depression, self-blame, family tension and stress because you're taking work stuff home, work withdrawal, and increased absence. Financial problems due to being absent from work, even post-traumatic stress disorder. Some negative impacts on the work group may include staff turnover, reduced productivity, increased errors, increased costs associated with investigations of bullying allegations, potential legal action, and loss of the facility's reputation. It is important to recognize what bullying is and what bullying is not. So, bullying is not respectful jokes, banter, and other interactions that are welcome and not negative in nature to any person or group is not considered bullying. Respectful disagreements and misunderstandings in the work area, as long as the employees involved remain professional, is not considered bullying. Performance of normal supervisory duties, if those duties are carried out according to policy in a respectful manner and are administered fairly to all employees, is not considered bullying. The Joint Commission recommends the following steps to address bullying in healthcare facilities.
The Joint Commission suggests creating a code of conduct that specifically addresses bullying.
The Joint Commission stresses education for all team members on appropriate professional behaviors that are consistent with the organization's code of conduct. The Joint Commission wants all healthcare facilities to hold all team members accountable for modeling desirable behaviors in the workplace, developing and implementing policies and procedures and processes that specifically and directly addresses bullying behaviors. The Joint Commission wants staff to be able to speak out if they feel bullied or witness bullying incidents, defining behavioral expectations.
Each department should develop a list of expected behaviors for employees. The following checklist provides some examples of expected behaviors for instrument technicians.
People need to know what you want them to do. Technicians should display positive communication behaviors
When dealing with all employees, by avoiding offensive and or harassing language and using constructive criticism when necessary.
Technicians should treat all employees, customers, and visitors in a respectful manner. Technicians should maintain a positive work environment by demonstrating mentoring and supporting coworkers, supporting the hospital's and department's mission, and handling problems positively and constructively. Instrument technicians should keep abreast of changes within the instrument system and the department by attending staff meetings and in-services, reviewing policies and procedures, and departmental communication systems, and asking questions as appropriate to ensure correct changes are implemented. Central service technicians facilitate good infection prevention practices by following department dress codes and environmental management guidelines as they pertain to area cleanliness, sterile storage, and handling requirements. We've completed learning objective number 4. We've defined bullying and we've discussed strategies to address bullying. Working within a group. In your role as an instrument technician, it's important to work effectively within various work groups. So the ability to communicate situations, ideas, and references in ways that have a positive impact on the group is critically important. All groups are going to have a specific mission or purpose. Every work group, regardless of its nature, is defined by a specific mission or purpose. This mission serves as the group's guiding objective and provides direction to its activities. Individual talents and skills. So work groups are comprised, of course, of individuals, each bringing their own unique talents and skills to the table. These individual contributions are vital for achieving the group's mission effectively. Unique group dynamics. So every work group is going to develop its own unique set of dynamics, including communication styles, interactions, and interpersonal relationships. These dynamics are going to significantly influence the group's working style, progress, and overall success. So when you become a part of a group, when you're assigned to any working group, you want to understand very clearly the goals and objectives of that group. You should understand your role. Working within a group can present some challenges, including differing ideas, opinions, and working styles that may lead to delays in decision making and plan implementation. But that's okay. Assembling a diverse group of people with various skills, talents, and insights to explore a problem can ultimately lead to very positive outcomes. To ensure effective collaboration, it's essential for behaviors within the group setting
to remain professional and courteous.
So, in the healthcare environment, it is vital for all staff members to take responsibility for certain actions. You have a professional obligation to seek clarification if you don't understand, asking questions, seeking additional training when necessary. Staff need to take responsibility for identifying potential issues to prevent mistakes at work. It is also very important to establish a culture across all departments in the facility where staff members feel comfortable asking questions and are committed to helping each other improve their skills. Instrument reprocessing is a team sport. Collaboration is key in instrument processing. Everyone involved must share a common understanding of the primary goal, patient safety. This understanding, patient safety, should drive teamwork towards achieving this goal. Responsibility for improvement. So again, every staff member holds the responsibility of asking questions, seeking additional training, and identifying potential issues that could lead to mistakes in their roles within the healthcare setting. Across all departments, it is essential to cultivate a culture where staff members feel at ease asking questions and is equally responsible for contributing to the learning and skill enhancement of their team members. Collaborative instrument reprocessing. Instrument reprocessing should be a collaborative effort involving all relevant staff members. Teamwork ensures the accuracy and the safety of the process, prioritizing patient safety. So, the overarching goal in healthcare is patient safety. Every individual involved in patient care must understand and work together as a team to achieve this primary objective. So, when it comes to instrument reprocessing and patient safety, fostering a culture of open communication and shared responsibility is crucial. This approach ensures that staff members feel empowered to ask questions, seek additional training, identify potential issues, and work collaboratively towards the common goal of patient safety. We've completed learning objective number 5. We discussed factors that impact groups. The instrument system is a human system. It relies on people to support the care and treatment of patients. Humanistic values and behaviors are imperative for success. The primary goal is the delivery of safe and high quality patient care. Patients depend on CS professionals to do their jobs responsibly, consistently, and effectively. Instrument processing staff must follow that very human thought.